Argon plasma coagulation, APC for short, is a thermal technique for the ablation of Barrett's esophagus. APC has been established for many years in gastrointestinal endoscopy for managing hemorrhages and for devitalizing tissue anomalies. HybridAPC is now available as an effective and protective technique for Barrett's therapy. It also utilizes the advantages of waterjet technology. The HybridAPC probe is a flexible, multifunctional instrument combining the well-known technologies of argon plasma coagulation and waterjet elevation. The distal end of the probe corresponds to a conventional APC probe with an axial outlet. However, the electrode to ignite the argon plasma serves at the same time as a high-pressure waterjet nozzle. Waterjet elevation and argon plasma coagulation. This means improved safety and more effective ablation. Perfectly tailored to HybridAPC and matched to your individual requirements, the ERBA GI workstation delivers energy for this instrument. HybridAPC from ERBA stands for a new therapy of Barrett's esophagus. Effective, protective, cost-efficient. Prior to thermal ablation, the mucosa is elevated with the high-pressure waterjet. The fluid accumulates in the submucosa, where it creates a water cushion to protect the underlying tissue layers, such as the muscular layer. The elevated Barrett structure can be devitalized by inputting higher energy than with conventional APC. The water protection layer makes the procedure more gentle and minimizes the risk of stricture formation. All localizations of Barrett's esophagus can be targeted by the contact-free APC application and accessed irrespective of the lumen diameter. The HybridAPC probe can also be effectively deployed in the cardia region and at the gastroesophageal junction. The single-use probe is connected to the APC2 and ERBA-Jet 2 of a GI workstation in the familiar, easy way. In contrast with alternative techniques, the HybridAPC application does not require any laborious preparation, and it is also cost-effective. The patient is positioned slightly raised for the HybridAPC application, so there is no aspiration. Chromoendoscopic techniques are used for Barrett's diagnostics, such as contrast enhancement using acetic acid. This makes dysplasias easier to identify and differentiate. The mucosa in question is raised with the high-pressure waterjet. Only just as much as is necessary, so that visibility in the narrow lumen is not impaired. The water cushion creates a safe distance to the underlying muscular layer. The argon plasma beam is then passed over the raised area in slow striping movements. A high energy input should be applied so that the depth effect is sufficient, and any buried Barrett glands in the submucosa can also be effectively devitalized. The use of a distance cap improves vision and at the same time enables detritus to be displaced. This allows the tissue effect achieved to be assessed better. The HybridAPC probe is very easy to handle. The waterjet and the APC can be used in alternation without changing the instrument. The Barrett's regions are specifically targeted for treatment with the HybridAPC probe. The surrounding healthy tissue is spared. APC activation is performed while withdrawing the probe, whereby the endoscope together with the probe are always moved back and forth. At the end of the session, a homogeneous coagulation surface is visible, where the Barrett's tissue has been devitalized to a sufficient depth. As with all thermal techniques, further sessions may be necessary. The completely healed epithelium becomes apparent several weeks after completing the therapy. New squamous epithelium has grown over the ablation surface. The histological evaluations show that the muscular layer is spared by using the HybridAPC technique. The protective cushion limits the penetration depth, which minimizes the risk of stricture. Water jet-assisted argon plasma coagulation with the HybridAPC probe is an effective, protective, and cost-efficient technique. Following on from the first promising results, the rates of eradication and stricture will be investigated in further clinical trials.